Good morning. This is Dr. Beau Clark, East Baton Rouge Parish Coroner. We're going to be starting our live Facebook Live press conference here shortly. Today we're going to talk a little bit about the COVID-19 cases that we've had recently, a little discussion about the prediction models and what's considered the surge, and we'll take some questions at the very end. While we're waiting for people to join us, I'm going to start by saying there was a little bit of confusion last week when we had a discussion on the conference about the gestational age of the infant that died related to COVID-19. So I want to clear that up real quickly. After I did the Facebook Live conference, I did a lot of interviews over the phone with media outlets around the country. And one of the common questions that was asked of me in general terms, is it possible for a infant born at 22 weeks gestation to survive, just in general terms, outside of the confines of this particular case? And so the answer to that is yes, it is possible. The statistics show us that the survivability of a child born between the gestational ages of 21 weeks and 25 weeks is less than 5%. So in normal circumstances, to be born that young, you certainly have an uphill battle with surviving, less than 5%. However, it's not to say that it's not possible. It is possible for someone born at that gestational age. Of course, the closer you get to a term delivery, greater than 36 weeks, up to 40 weeks, which is considered term, obviously your chances of survival are much, much greater. And having said that, I can report to you today that the COVID swab that was done on the infant has come back negative. However, this is still considered a COVID-related death, and I'm going to explain to you why that is in just a few seconds. So what does the negative swab tell us? The negative swab confirms to us that there was not any vertical transmission from the mother to the infant. There are certain viruses and diseases that we are aware of, and an example of one would be HIV, that can be vertically transmitted from mother to unborn child. We don't have a lot of data about COVID and how it relates to vertical transmission. The CDC thinks that it's not a vertically transmitted virus, and certainly this case proves that they are potentially correct in that idea that there's no vertical transmission. Having said that, I know a lot of people are still like, well, if the infant was negative for COVID, how is this a COVID-related death? And you have to understand it's a COVID-related death because of the intimate relationship between a mother and her child. As the child is in the womb, it is relying 100% on the mother to provide the things it needs to sustain its life. One of those most important things is oxygen. As the mother breathes in and breathes out, oxygen then goes to her lungs and then travels through her circulatory system and eventually ends up providing oxygen to the infant. And it's because of that relationship in this circumstance, in this case, why this is a COVID-related death. If we talk about the immediate cause of death of this child, it's extreme prematurity. It's because the child was born at such an early age. But you have to ask yourself, why was there extreme prematurity? And the answer to that question is because the mother went into preterm labor and delivered the child prematurely. But she did so because she was in a hypoxic state related to being COVID positive and being on a ventilator. So it's that sequence of events that makes this a COVID-related death because of the intimate relationship between the mother and child and how that translates to the death. Some other comments and concerns have been expressed to my office about how people feel that it might be disrespectful or distasteful for us to talk about such morose topics as death. Obviously, as the coroner of East Baton Rouge Parish, I'm charged with investigating those deaths. But there's another thing that you may not be aware of, is that Louisiana law requires me to release this information. So regardless of even my own personal feelings of whether it should be released or not, I have no choice under Louisiana law but to make this information public. I certainly attempt to do so in a very respectful manner. I try to limit the amount of information to what is required to me by law. I try to protect the families who are certainly going through some very tough times grieving right now. We talk to the families every morning when we get to the office, we call the families and inform them of the information that we have at hand, even before we release anything to the public or even have this Facebook Live conference. So I wanted everybody to know we're in compliance with the Louisiana law. That's why we release the information, and we'll continue to do so. I'd like to share some general thoughts about COVID-19, specifically the pathophysiology. I know a lot of times we are now stuck in the stay-at-home or the quarantine, and we get a lot of our information from different sources. You may watch TV, you may listen to social media, but essentially, in essence, the way the pathophysiology of this virus works, it's a respiratory virus. It attacks your respiratory system, and one of its major effects is it causes low oxygen, or what we call hypoxia. So as the virus attacks your lungs, you are not oxygenating well. And of course, we know as humans, we need oxygen to survive. When we are not able to oxygenate very well, we have a mechanism in our body where our lungs begin to try to ventilate better, to consume more oxygen. An example of this be like when you exercise. When you exercise and you're using oxygen to exercise, you begin to breathe harder, you begin to breathe faster. And that's because your lungs are compensating for the need for more oxygen. This is similar with COVID-19. With COVID-19, you are hypoxic, you begin to need more oxygen. Therefore, your lungs begin to work harder. They work harder by breathing faster, by breathing harder. And eventually the body can only do so much. And that's where we have medical interventions such as ventilators, where we begin to ventilate the body for you, ventilate the lungs to try to help with this hypoxic state. And so that's where, that's in general terms how the pathophysiology of this disease works. Now, there's a lot of other components to the disease that have to do with the lack of oxygen and how it affects other parts of our body, such as our brain, our heart, our liver, our kidneys. So we start to see other systems of the body be affected because of the virus. But it all starts with this respiratory insult that is related to hypoxia. Real briefly, we'll talk about the new numbers now. We have 63 East Baton Rouge Parish residents that have died as related to the COVID-19 virus. We are still tracking 2 Mississippi residents. By statute, I am required to track those. However, they will likely be counted in the overall numbers that be published by the state of Mississippi. We've seen a lot of prediction models out there. Currently, it is March the 13th. And they had predicted, April 13th, and we had predicted at this time that we would be in what they refer to as the surge, when we'd see the majority of issues, people needing hospitalization, people needing ventilation, and then seeing the death numbers rise. I can report to you over the past several days, we have seen very high numbers, the highest numbers in a 24-hour periods since Thursday, Friday, and then over the weekend. A lot of people like to say, well, are we done with the surge? Is it over? We really won't know that information until we're beyond it. And we look back and say that's when the surge occurred, between one date and the next. So we won't know that until it's done. I certainly share this with you because I believe we're in the midst of it now, and the potential is that we'll be coming down on the backside of the slope of this crisis here shortly. And in doing so, what we have to remember, it's probably the most important thing to remember, is not to be complacent when it comes to our quarantine and our stay-at-home orders and our social and physical distancing. And the reason for that is because we can always have a second spike. If we release our guard too soon, ultimately we end up having another spike in infection, which of course could potentially overwhelm the system, could cause more hospitalization, could cause more people getting ill, more people dying. So we have to be very cautious when it comes to that. And we'll be monitoring it closely. So that is my report for this morning. Certainly would welcome any questions, and we'll watch them come up on the screen and try to answer them the best we can. So if you have got a question, please send it to us. If we miss your question, I apologize. They sometimes happen very quickly, but we certainly try to go back and answer them through Facebook after the presentation.
Doc, while we're waiting, what can folks do other than just adhering to the stay-at-home orders, just to kind of help their own resistance to getting sick with this or any other disease?
Sure. So taking care of yourself physically is very important. Certainly, we all know we're abiding by the stay-at-home and the quarantine. It doesn't mean you can't go outside and go for a walk. It doesn't mean you shouldn't be eating properly and even taking time to exercise. And so those all can still take place even though there is a quarantine happening. If you've got a bicycle, go for a bike ride around your neighborhood, practicing social and physical distancing. If you've got an exercise routine, try to keep it. If you've got a general regular routine, I know you don't get up, most of us don't get up and go to work because of the quarantine, but it doesn't mean that you can't, get up and have a semblance of that routine at home. Certainly, it's very challenging, obviously, to avoid repetitive trips to the refrigerator and over snacking because it's available and we find ourselves sometimes bored. But certainly, be cautious of that in trying to maintain a good routine at home as best as you can. I've also said in the past on these conference calls is to make sure you check with people, give them a call, check your neighbors, especially the high-risk population, anybody elderly with chronic medical illnesses. Make sure that you can they get the things they need. They may need help getting to the grocery store, and you can do that for them. I saw somebody ask the average age range of those who have died. We'll go back and we'll tabulate that, and we can answer that through the feed after this. So somebody asked a question about doing an autopsy. An autopsy in these cases has not been necessary. We know prior to death the clinical course of their illness that is then confirmed with a positive nasal swab. So we have not had the necessity to do an autopsy in these cases. Certainly, we would be very cautious in doing autopsies because that can contaminate the people that are here at the office that will be doing those autopsies. So we're very cognizant of that. So mask, gloves, staying at home, staying safe are all very important. Certainly, the CDC has recommended that wearing a mask is appropriate. Especially if you go out in public, if you're going to make that trip to the grocery store, certainly putting a mask on to protect yourself, maybe gloves if you're going to be touching things, and make sure you decontaminate yourself when you get home, wash your hands. So that becomes very important. And then just stay safe. I mean, clearly if you do go out to the grocery store, one of the things you'll notice is there are fewer cars on the street, but still be aware of your surroundings. We are having, people have motor vehicle crashes and other types of death as we go through this crisis. So just be safe. Question. So somebody asked, is it people dying because they can't breathe, or is it organ failure? It's actually both. It starts with the hypoxia, the inability to breathe, the low oxygen levels. And then, of course, all of our organs in our body require oxygen. So as we're unable to oxygenate very well and get that oxygen to those other organs, the other organs don't function as well. So both things happen, but it all starts with the respiratory insult that is related to the COVID-19 virus. Unfortunately, I can't read the rest of the question there, but I'll have to get back to that one. From Heather.
She says, I have a pseudo-obstruction disease, diabetes, thyroid, and no parathyroid, which I battle with low calcium. Does this put me at severe risk of contracting disease and not be able to fight it?
Yeah, so Heather asked, and she lists some comorbidities. Certainly the ones that are listed are of concern, and you probably should consult your doctor. But what you should do in the meantime is obviously socially, physically distance and protect yourself. That's the biggest thing.
Morgan.
I didn't see what it said.
Are you doing autopsy on those who have passed away who test negative?
Yeah, so we would only do that if it's absolutely necessary. If there's not enough clinical evidence in their clinical course and medical history to not tell us why they died. So, for example, if someone clutches their chest, says they're having chest pain and dies from a heart attack, that's not a COVID-19 related death. That's clearly related to a heart attack. So we look at all the clinical data from presentation and certainly make a determination if it does fit into the COVID-19 virus scenario, or if it's other form of natural death, and we categorize it as such. Certainly do autopsies when autopsies are necessary, but only when autopsies are necessary.
All right, Frank Campbell. Mental health law allows for custody when imposing someone to risk to self or others. Would encouraging folks to break social distancing rules qualify?
So there was a mental health question. Obviously, there's still a concern over the folks that are having mental health crises in our community, and we're working very diligently with those families. A lot of the mental health community has gone to telemedicine and telehealth. So access to someone's mental health provider has become as easy as a phone call. And I know a lot of them are being able to treat them over the phone with them not having to require hospitalization. However, that being said, we still have the ability to have someone picked up if necessary for an evaluation. But we take each one of those cases individually. So when it asks if a person's test is inconclusive, meaning that let's say they have a negative COVID test, what we would do in that circumstance is we would look at their clinical presentation. And these are guidelines that have been set down by the CDC that says if they meet a clinical presentation that is consistent with someone that would have COVID, then you can still call it a COVID-related death. Now, that should be a rare circumstance. Really, we are calling things COVID-related deaths or COVID deaths when we have a positive swab and their clinical scenario or their clinical condition is corollary with a respiratory illness. It would be a very rare circumstance that we would call it a COVID-related death, but they would have to have a clinical course that was consistent with COVID and a negative swab. There might be the potential that we would list that as a COVID death, but it would be very, very rare. So how long does the virus live in the deceased? That's an excellent question. We don't know. And we don't know because this is such a novel and new virus, we don't have any idea. So we are taking extra precautions, specifically my office as well as the hospitals, as well as the funeral services when we deal with the decedent's body, ensuring that we're using universal precautions, wearing gloves and masks, because we don't have any clear guideline for understanding how long the virus would live. So most viruses can live, the other viruses that we encounter can live 5 to 7 days in the body, but we just take precautions with everybody we encounter, specifically the COVID-19 folks. What are the funeral requirements and restrictions for COVID victims? So on two fronts. Number one, the funeral homes are now requiring using personal protective equipment or PPE in dealing with the COVID-infected bodies for their transport. The state of Louisiana did send some guidelines out that asked for families to make fairly rapid decisions in the disposition of their loved one, whether they were going to cremate or bury. That decision they're asking to happen within 3 days. And then ultimately they're asking for there to be some final disposition by 10 days. So it's kind of a 3-day to 10-day scenario. And so the funeral homes are working diligently to assist with families in making that disposition and of course, carrying out anybody's final wishes. Does taking zinc and tonic water daily help to minimize catching the virus? There has been some thoughts that might be possible. However, there's nothing that's scientifically proven that either one of those work. There have not been enough studies to say, yes, this is the zinc and tonic water, the end-all be-all, and we should all be using it. However, because we don't know if it's something that you chose to try, it potentially could help. We just don't know. We don't have a good answer for that yet. Is it true that it can become a yearly situation just like the flu? Yes, that is absolutely true. It is possible that we can see coronavirus again in the world, just like we have a flu season every year. Now, it is uncertain whether we'll have a coronavirus season every year or if this may be something we see every so often. and I'm sure the folks at the CDC are going to be monitoring that very closely. They will also probably be monitoring for a mutation of the virus, where the virus changes its form, where we have to combat it differently. So yes, there are possibilities that absolutely can happen. If the mother had the flu, would the infant death be flu-related? Yes, that's an excellent question, whoever asked that. Yes, so if the mother's flu caused her to have hypoxia, respiratory depression, and that translated to the premature delivery of a baby who died from extreme prematurity, the same scenario I just discussed, yes, it would be a flu-related death, absolutely. And so the circumstances in this case would be very similar because it was a COVID-related death. That was a good question. Why is hypertension such a high underlying condition with the virus? From a cellular and molecular level, there are certain cells in the body, cells in the lungs, that are related to this phenomena that have to do with hypertension and oxygenation and related to the respiratory system. And it is believed that the virus, among other things, can affect the way these cells function. So that's why hypertension is considered a comorbidity. Oftentimes with hypertension comes the diagnosis of diabetes, which, as we know, is another comorbidity. And then a third comorbidity might be underlying lung diseases like pulmonary fibrosis, chronic obstructive pulmonary disease, or COPD. And then, of course, age is a common denominator in a lot of the individuals that we're seeing. And it's because the older population tend to have these comorbidities that we've just discussed. Thank you for thanking us for what we do. We're happy to do it. This is our job, but we really it's challenging. It really is. We're not only dealing with the deaths we normally deal with in this community, but working along with COVID-19 deaths and the families as well.
Tell Gary I'll get the numbers and put them up.
We're going to put the numbers back up there
for Gary Chambers.
For Gary. I know you asked a second ago. I apologize. We'll get back to that question. Did you see Leah's question?
Yeah. Could you talk more about the trends we're seeing in Baton Rouge deaths? How long the current surge is expected to last, and when we might see the numbers decrease?
So Leah asked a question about the surge. We don't know how long the surge is going to last. I think we're in it right now. We won't know that it's over until we start looking at the data and see that the numbers have now started to decrease. And we can, in that way, we can look back retrospectively and say what they are. It is we have to look at it backwards to kind of say that we're out of it and on the downside of the slope. But I think we're in the surge as we speak.
Are any morgues in Louisiana having problems with overcrowding?
So we've had a few morgues in Louisiana having issues with overcrowding. We know in the New Orleans area they've had this problem. Here in Baton Rouge, we've worked very closely with the morgues at the hospital, the morgues here at our office, of working very diligently to help families make a disposition decision. And it tends, when they make that decision fairly rapidly, whether it's burial or cremation, that we can make that happen in short order, and thus relieves the stress and strain on the morgue capacity. New Orleans, I think, has had some challenges with this, but I'm sure they're working through it much like we are. So the question Gary's asking about, I think you mean expanded testing, not texting. Yes, of course. I think, if you've got symptomatology, we should test you to find out what you have. It does two things. Number one, it lets the individual know that they are potentially infected. And number two, it allows us a response, not only for them to self-quarantine, potentially for other people to be cautious around them, which we should anyway, but also to be cautious around them so that we can ensure that we're not continually to affect people over and over again. So if somebody's had a possible exposure, what are the proactive measures they can take ahead of the virus? So certainly maintaining good health. If you think you've been exposed, then you might consider even quarantining yourself to say I've been exposed. Maybe I should watch myself very closely for symptoms such as cough, shortness of breath, and fever. So I would take that into consideration and protect yourself and your family if there's a potential for an exposure. Now, having said that, there's a lot of healthcare workers in our community who go to work every day, and they get exposed. I mean, they're working in the emergency departments, they're working in the hospitals. And so I think those folks are taking extra precaution when they leave their work environment to decontaminate themselves and maybe even isolate themselves when they get home from their loved ones, and monitor closely for symptoms. So I think those are the things you can do. They have not developed anything that's been scientifically proven to be prophylactic in an exposure scenario, but that is one of the things that they've been researching and looking into. So, is tachycardia an increased risk? It would depend on where the tachycardia is coming from. Tachycardia being a fast heart rate. If the tachycardia is a result of another underlying disease, such as heart disease, yes, it would be. But you would really, the best thing to do would be to consult your cardiologist so you could understand the etiology of your fast heart rate. Is there a test for acquired immunity? That's what they're working on. That's a very good question. Right now, they're attempting to develop an antibody test to see who has already been affected, who has the antibodies to fight the virus, and essentially who's developed natural immunity. And by doing so, then that will allow us to know who can be re-injected into the work environment very safely, because they shouldn't be able to catch it again once you have a natural immunity. There's a question about, can it be transmitted through food? Yes, because food can be touched by someone's hands, but it is not a GI or a GI transmitted disease. It's a respiratory transmitted disease, but you can contaminate food. So that's why it's very important to make sure you wash your hands, especially when you're before and after you eat, and especially if you're giving food to another person. You'll see a lot of times if you go out and order food nowadays, a lot of the food workers will have gloves on to prevent that transmission. So that's a very good question, very important to understand. So. All right. Well, it looks like all the questions. If we missed your question, I apologize. We will definitely hop on the computer and try to answer them quickly. We will hopefully be back next Monday for another press conference to relate information. However, during the rest of the week, we will still be sending out information to the media outlets so that we can keep everybody up to date. So please stay safe. Please continue to quarantine. Please have physical and social distancing, but also please check on the folks that need our help. If you've got an elderly neighbor, maybe your parents, somebody that might need some help, see what you can do to help them. I know they'd really appreciate it. So until later, stay safe.